Hello, and welcome everybody to the Bridging Frequencies Beyond FSM podcast, where I interview inspiring practitioners that I find to be fascinating. And one person who I find especially fascinating is here with me today. This is Brittany Bailey. Hi, Brittany.
Hello.
Brittany has her master's in respiratory psychophysiology, and she is a myofunctional and breathing therapist practicing in North Glen, Colorado. And I am so excited to have Brittany on today because I did not know that myofunctional therapy was even a profession and something that we can offer our people. And when I learned about it, I found it to be totally fascinating. Plus, Brittany, in her approach to Mayo, is sort of a pioneer, a revolutionary. She's sort of pushing the leading edge of the field. And so we'll get into that too. So thanks so much for being here, Brittany.
Thank you.
And I guess we'll just start by defining what is myofunctional therapy.
Yeah, so myofunctional therapy is a therapy based on how we use the muscles of our face and lips, and primarily the tongue. So the tongue is crucial for proper growth and development in little ones, but then also various functionings like eating and speech, and then airway health. So we have exercises that help train the tongue in whatever way it needs, whether it needs more strength or endurance or tone to rest properly up in the roof of our mouth. That helps palate growth, nervous system input, and then airway health. And then we work with also the muscles of the jaw and of the lips to have just proper posture and function of those structures.
Awesome. And I guess my next question would be what does a sort of treatment trajectory look like? Is there an assessment piece and how that all looks? And do you use tools or yeah, what kind of approaches you use throughout the sort of trajectory of a treatment?
We start with an assessment, and that is approached in various ways. I love to hear the person's story. Number one, what they're coming in with and thoughts, and usually they're coming in with kind of an inkling of like, I don't think this is normal or ideal or whatnot. And so that starts the formation of the puzzle. There's a lot of puzzle pieces. And then I ask very specific questions of the mouth and other functions that people may not have ever thought about. So, like the big questions, of course, are how does someone breathe through the nose, through the mouth, and is there pain? Is there discomfort in any way? But then I start to ask about where does your tongue rest in your mouth? Or, do you have texture issues or just pickiness with food? Is talking tiring? Those little nuances and things that most people just power through and they don't think about, or they compensate for. So that starts the conversation, and then I take a full assessment of the muscles of the mouth and of the face and various structures, structure of the palate, of the jaw, of the tongue and its range of motion. So I test muscle strength, movement, and just really trying to see patterns that this person may have when using their face in any capacity. And then that's the initial assessment. But with Myo, you're always learning as you go. Usually, after the first assessment, we start exercises, and they are strength based, endurance based, flexibility, just depending on what the person needs. And then as they work through their exercises, they learn more about their habits, patterns, weaknesses. And then we're always gathering data of, oh, yeah, I do this when I sleep, or I woke up this way, or I can't chew steak, or everyone's so different. So there's so many possibilities. But as we get the ball rolling with treatment and exercises, how they are progressing and responding and learning about themselves guides future sessions. So I go off of, what they are experiencing and always assessing every session of like, okay, how are the muscles now? How are the structures now? We take measurements and retake measurements. So always assessing, but
Hmm.
we get exercises rolling pretty quickly. And then the person learns so much at home too, which then they become more and more advocates for themselves, which is amazing.
It makes me think of like physical therapy for the jaw and face and mouth.
Yeah.
But it's so specialized. And I would imagine, and maybe this is just a projection, I wonder what you would think about this. But I would imagine that most humans would probably benefit a little bit from some sort of biofunctional therapy, but maybe not. What is your take on like who benefits?
I would say pretty much almost anyone would benefit. We stretch our hamstrings, we stretch, our arms, our back, our neck, but we never stretch the face or even think about it or approach it. And many topics that we are so used to in the general sense of sleep apnea, mouth breathing, just picky eating, always being tired, moving around a lot in sleep, clenching, grinding.
Hmm.
We've heard those, and we all probably know someone or are someone that has a layer or a factor of those, and that those are big signs that there's something muscularly lacking in the airway or mouth. But even something simple as someone using straws a lot to avoid like coffee stains or tea stains on the teeth, like straws have impact on our face.
Hmm.
And the way we've all grown from the 50s forward, our food got softer.
Hmm.
And so we've challenged these muscles way less just as a whole.
Hmm.
And it's common for all of us to need our wisdom teeth removed. At one time, that wasn't needed. And so generally from our food and various other reasons, we've all been impacted muscularly and craniofacially, um, which kind of supports my thought that everyone could take a look at the muscles of their mouth because it's been a widespread epidemic just with our foods, let alone other epigenetic and airway components and factors like that.
Yeah, my next question was going to be like, what's the root cause of some of this orofacial dysfunction? And it sounds like there's potentially a cultural root cause and maybe a genetic in some cases. Yeah, anything else you want to share about that?
Yeah, so our foods have gotten softer, and that is very demonstrated in the sense if you go to a museum or some historical outlet and you see Neolithic skeletal demonstrations, they have all their teeth and they're pretty much straight.
Mm.
Nowadays, we need braces to have straight teeth, pretty much. And they were challenged by their food and they chewed and chewed and ate solid nuts and meat. And so they exercise their mouths through their living needs and everything. So with the food getting softer, but then pacifiers and various oral components like that serve a purpose at a time, but then if it gets latched onto for a while, like thumb sucking, that has an impact. It blocks the mouth from being fully used to its full potential. And then other genetic components of, the big topic in the Maya world is tongue ties,
Mm.
and that does have a genetic component. It can, and that is where the tongue just does not have full function. It's restricted in mobility. Um, so it's either or, chicken or the egg. A lot of people potentially have all those layers, and So it's definitely something that everyone, I would say, should be checked, just like you check your hearing and vision. Your airway is crucial, and the mouth is connected to it and has such a relationship to it. So checking the airway, because I think we all have one of those factors of the change from the foods or other factors.
Yeah, that's so fascinating, and it makes me like wonder if there's a space in our culture and our practice for like just get your yearly airway checkup, or it's kind of like
Yeah.
a yearly postural checkup with PT, a yearly airway checkup, just because I would imagine that we can do something to prevent sleep apnea. And I'm just personally in my practice like shocked by how many people have that diagnosis now. And it's like, oh my goodness gracious, what is going on? Um, yeah. And let's see, I had another question. What was it? It was around, um, well, are you seeing sleep apnea in kids?
I am quite
Mm,
a bit.
wow.
That makes up a good chunk of my practice.
Really?
And that's where it's lovely. The airway field that includes myo, airway dentistry, airway orthodontics. We're flipping the script, because sleep apnea is not just 50 plus, certain body type, certain neck circumference, coming of age life happening. It is the tongue slipping into the airway and other factors like tonsils, but really obstructive sleep apnea, something's in the airway.
Mm,
And that can happen at any age. It is not about those factors that usually stereotypically get brushed off of. Oh no, you're not that body type. Your neck circumference is fine. So I see a lot of kiddos where sometimes it's a matter of determining and working through that question: is there potential sleep apnea or sleep disturbances? And in kiddos, it's usually expressed in the form of clenching or grinding,
mm,
bedwetting,
mm.
past an age where someone or a parent may assume, like, okay, it's time to have that control. Um, Moving around a lot, wired but tired behaviors, like really right before bedtime, night terrors, sleepwalking, sleep talking. So those are things that can kind of make it hard to determine. We isolate those expressions, but really that's the body reacting to potential airway disruptions. And that's where it gets tricky. That's where Mayo's great, where we really work kind of funnel down. Okay, these are the expressions, but what is the root? What is underneath that? And then, I'm a fan of teamwork, of an ENT getting a sleep study, full picture,
Mhm.
because, you know, being wired but tired isn't always just a behavioral thing, or not being able to focus in school, or being a little rambunctious. Sadly, if a kid gets labeled like that and then gets sent on their way, their body's just expressing a need, sensations that it's feeling, and it's not the root factor. So I see a lot of families where they're kind of at the wit's end, in a way of like, we don't know what to do. Um, this is an issue. They're so tired, but struggling this way or that way. And I've seen amazing changes, and have been able to be a part of amazing changes with these families, where the parent comes back after hard work. It is a commitment, definitely, where they go, well, my kid can now sit, be centered, color, and is comfortable in their skin. Which is like, wow, like, I know this works and I believe in it, but when I actually see it, I'm like, yeah, this kiddo did have airway disruptions, which impact the brain and the heart and growth and development, and so much more than
How
just
many
that.
things?
Yeah, like it's really powerful, and it makes me personally really look inward and go, what have I just accepted as is, versus okay, is that the tip of the iceberg? But what's underneath the waterline, because it is mind blowing to see kiddos just suddenly be able to breathe better. And then from breath comes life, uh, you know, and that is, yeah, life changing, truly.
Totally. And why don't we think about airway problems when we've got these diagnoses of ADD and blah blah
Yeah.
blah, like all of these things? It's like I don't know if they still do this in school, but when I was in, I don't know, second grade, we got like the scoliosis check in gym class. It's like we should do a like an airway check. I mean, that's just it sounds like there's such a potential um, for support, and it's so underdiagnosed or underappreciated is my sense.
Mm-hmm.
Because like, I mean, I was really surprised not to know about this field in my medical training. It's like it wasn't even covered. And I did do like a con ed course where we mobilized the cranial bones and we had sort of an approach to creating space in the cranial vault from a bone perspective. And yeah, there's like ways we in PT school it's touched on like this much. Oh, we release the lateral pterygoid or whatever. And it's
Yeah.
like basic and the whole picture isn't really presented.
Mm.
I'm super interested in what you have to share about the nervous system. It's totally my passion in my practice, and I just can imagine all of the implications of this. I mean, you spoke to some of them, but do you want to dive a little bit more into how your work or how the dysfunction impacts the nervous system and maybe how the support of the system impacts?
Absolutely. Because I love the nervous system too.
I know you do. I love it.
I do. And it's been an ongoing process of weaving that into this field. Of course, airway disruption. Um, and when I really say that, it can mean many things, but in the myo sense, a lot of it is the tongue just slipping back. A lot of our tongues rest low in the mouth, and ideally we want it up in the palate. That takes fitness of the tongue muscles, 8 of them. So with that airway disruption, especially at night, it's going to signal to the body, hey, we're in danger, fight or flight mode all night long. So if the tongue creeps back there or fully goes back there, it doesn't matter. The body is going to try to find a way to keep it open all night long. That is through clenching, grinding, moving, tossing and turning. So the brain's busy all night long doing that. So you're not going to be fully rested. So that's a huge nervous system impact, airway wise. And in addition to that, not everyone has that airway impact, but their nervous system is still highly impacted by the mouth. When the tongue rests up in the palate, and when I say that, I mean like as much of the tongue as possible. Some people just have the tip up. We want as much of a tongue seal as possible on the palate. Various reasons. It does help widen the palate and create spacing for the teeth and little ones and proper airway and palate development, but also through the palate is the vagus nerve. So when stimulated, it has so many benefits, and one of them that I highlight with a lot of my families is serotonin, which is wonderful. I explain it to them, the sunshine chemical. We all want serotonin. That is not wrong. If the tongue is not up there, you're missing out on an opportunity, a huge one. And that's usually where the body is impacted by that lack of nervous system input from the tongue, which we are beautifully designed that way. But when that's not happening, the body still wants serotonin. The person will find another way. So that can be from thumb sucking. The thumb is stimulating the palate, nail biting, picking, just picking elsewhere, chewing on pens, pencils, clothing, which that is a compensation. It's not really the true, beautiful source that we've been how we've been designed to. So nothing beats the tongue up in the palate getting serotonin. So the person
I just
that
hold on. I just like nothing beats the tongue up in the palate to get serotonin. I feel like that's such a big takeaway, and I bet people who are listening are going, "Where's my tongue?" Like I know I'm
yeah.
like, "Oh my gosh, wait, how much of my tongue is actually touching me from my mouth?" And it's, I mean, it's. I think it's. I just wanted to pause and like highlight that because beyond what you mentioned, nail biting and I'm like, oh, I bet I know some adults that are nail biters, right? And it's like, oh my gosh, could it be related to this orofacial dysfunction, this tongue positioning challenge? Um and yeah, I just would imagine that people aren't making those connections. This is new information for a lot of people. So anyway, didn't mean to interrupt you, but I also wanted to like highlight that 'cause I think it's important.
That no, that's beautiful because it is white noise. I call it that. Until you bite your tongue, you don't think about your tongue really all day long, and we use it for so much. So you are so right to have that pause and to encourage people to kind of turn inward. What does my tongue do? What are my little habits? Because that's part of my assessment where I'll ask questions and I tell my patients, if you don't know the answer, that's okay.
Hmm.
We will learn as we go
Hmm.
because it's a lot of, I don't know, I've just always done this. I've always done
Hmm.
that. But
Hmm.
and the body's beautiful in the way we get the tongue up in the palate, which, does come with training it and exercises. And then, um, the body then responds and goes, yes, thank you. And then with the tools through Myo, that becomes your normal. As you work through this, we want that to become your new normal so that the compensations and expressions that you were experiencing, we are now met with the proper posture and nervous system input. And then from there, people go, whoa, I didn't realize how much I was, how tired I was, or how much I was relying on this or that to get me through the day. So it's fun to see on my part. Like I never get tired of just the the impact of the airway, but then the nervous system component goes hand in hand. Can't really separate them at all.
So cool. I have another question. Do you support, well, have you helped people avoid surgeries or helped recovery from surgeries?
Yeah, so a lot, I wouldn't say a lot. I've worked with people to avoid jaw surgery when appropriate. And then I've helped people retrain their muscles and their patterns and habits post jaw surgery, after a tonsillectomy, or even if they've had both tonsils and adenoids removed. We work on making sure that the habits they had from potentially inflamed and enlarged tonsils, that we properly now train the tongue function. Because like when I was little, I had sleep apnea. My tonsils were huge. I had them removed, but the tonsils trained my tongue to push forward
Mm.
because it was just taking up so much space in my airway that then my tongue posture was way more forward. And I had to mouth breathe to stay alive at that time. Got tonsils removed. I was still a mouth breather,
Mhm.
just because that's what I always was. So my airway was open, but and my parents didn't know, no one knew, and I was breathing better, and it was a success in a way. So a lot of times, post that, we train people to then breathe through the nose and feel safe breathing through the nose and switch. So Myo is wonderful. It can be coupled kind of with anything and very flexible. I partner with orthodontic work, speech therapy. This is non-surgery path I'm now explaining, but kind of anything and everything we can partner with and be very, very flexible. And the big part of helping post-surgery or pre-surgery or to avoid surgery is at the end of the day, really addressing the muscles because muscles pull. If they're tight, if they're tense, they're going to pull on bone. well, that could skew what the true jaw alignment is, or just truly what is going on. So I always say, let's try myo, see what the body can do, address the muscles, relax the muscles, train the muscles properly. And then if someone needs something extra, be it a surgery or orthodontic work or anything else, then we know the muscles are harmonious. We've done that work. Now we have a clear view on the skeletal needs or functional needs that someone has. So it's a good funnel down whatever someone's potential surgery storyline is, or if a surgery is needed or not.
Great.
So it kind of helps provide some clarity for people at times.
Awesome. That sounds amazing. You started to speak a little bit about maybe what got you into Myo, and I'm curious about your story, like how you even found out about this and what drove you to do your education and pursue this as a career.
Yeah. So as I mentioned, I had sleep apnea as a little one. And then I started clenching and grinding a lot when I was in middle school, and I had braces and my teeth were straight and lovely. And then I got the braces removed and then my teeth went crooked again. And I was like, man, bummer. That stinks. And then we went into braces again. Like my parents were so lovely to sign up for braces again. And then they were straight and beautiful. And we realigned my jaw and I had a lot of jaw components. And then I got the braces removed, wore my retainers. And 3 months later, my teeth were crooked again.
Wow.
So even with all the effort, the retainers couldn't hold it. My tongue was pushing on my teeth so hard that it rearranged my teeth. And then at that point, a lot of people were like, well, bummer, like you're just intense, you're just stressed, you are just, that's who you are. We don't want to work with you. It was a hurtful process of being kind of understood. And then most doctors were just like, oh, just try jaw surgery. That'll help you to re-straighten your teeth. And they didn't really provide any deep insight of why. And they're like, it may help you, may not. So I was like, that's not assuring or confident building. And then someone just, I think to get me out of the door was like, well, try myo, whatever. So I started myo and it opened my eyes of like, well, my muscles have never been addressed, considered, asked about. I didn't know where my tongue was. So I went full on patient mode. That was my first step into myo. And then starting to see and ask questions about my breath made me go, what? It was just eye-opening. And then through schooling and everything like that, again, just those light bulbs of why wasn't this a thing when I was little? And, this needs to be out there. So I love it now more than ever. Like I just keep falling in love with it because it is a huge missing piece to it. I think in the set, Myo was developed in the 70s. So it's definitely not something new. But over, the decades, it's become more of an airway function or airway component versus just speech, how it started. So it's very much speech based. So it's exciting. Like I'm thrilled. And so to have the personal view helps me because myo sounds wonderful and exciting and yay, but a lot of people, by the time they get into my office they do have the same hurts that I have, or their kid is being threatened to be kicked out of school. So, I think the empathy and experience that I have developed from that has made it even more of a mission because I've been there, and myo helped me straighten my teeth. It's never guaranteed, but for how my myo journey went, I was able to gain a lot of dental alignment naturally versus going back into braces. So I haven't had braces again since I undid it the second time. and it did require a lot of work, but it just showed my muscles were the issue and my tongue was the issue. And then working through myo, my body responded and said that, oh, thank you. You're not pushing on us or forcing us in any which way.
Amazing. Yeah. So it's so great. And I'm sure just being able to relate to your clients from that perspective is so useful. And I think it's a gift, too. Um, okay. So the question I've been like excited to ask you is because I really respect people in their field of medicine, especially who are like, not pushing the envelope, but like progressing the field. And
Mm.
when I learned about sort of what myo usually is and how you're approaching myo with a population you're working with, I was like, oh my gosh, this is so cool. And I would imagine that there's also pushback and criticism and so on. But first off, maybe let's start with um, how you do myo differently in your practice.
So I see all ages, which sounds like a given, but in the myo world, that is not. Usually it's 5 and older, with the argument that someone has to cognitively know what they're doing. That's the argument for starting at 5 and not going younger.
Hmm.
I see 5 and under. That is one of my missions and big passions because of the need I was seeing, where I would be seeing like a 7 year old, and then the mom would ask me questions about the sibling that was 4 or 3. And the mom is crying, or the dad is crying, like, we don't know what to do. And so I have developed, there are two different approaches. 5 and older is different, very different.
Hmm.
But 5 and under, or under 5, there's so much we can do. And yeah, they don't cognitively know that they are helping their airway. But there are many, many studies out there that show, on average, by the time you're age 6, 60% of your airway and craniofacial structure is developed.
Wow.
So
That
I heard
only
that, and
leaves a small window for like change. Yeah. Wow.
yeah, so I'm like, why would we wait until 5 or 6? You don't grow out of mouth breathing. You don't grow out of any of these symptoms, expressions, or compensations. And when I hear about kiddos, you know, this sounds kind of crazy, but it's not. I've had parents say the only option for my 3 year old is a CPAP machine. Time and place for those, but I don't think 3 year olds should just, that's their lot in life now. Bummer. And so I could talk all day about it. I'm just
Yeah.
so passionate about it.
Yeah. Keep
So
coming. This
you
is
start
fascinating.
early. The earlier you start, the more prevention you have versus catch up versus retraining. There's a lot we can do 5 and older. There's no bummer, you're this age. But why not also see 5 and under? Because, I've had 3 year olds snoring, gasping, drenched in sweat in their sleep because their body is working so hard. They do the games. They're more game approach with that age. And I keep it fun, goofy, silly, joyful, all of it. And then within a couple of months, parents have said they are sleeping through the night. They have come into their own. They're more confident. They're rested. They don't have the black shiners under their eyes. They're not, they're trying more foods. Just so much life changing things that, if they're fine for some people, we take them for granted, but if they're not fine, they're highly impacting. So that's where I was like, I'm seeing 5 and under. And it is met with a lot of criticism just based off of that cognitive defense. But, I used to teach preschool, and that has helped tons in the approach. And the way I approach it, it's all individually catered and based. So I don't have a strict program or a protocol or a cookie cutter that anyone, regardless of age, needs to fit in. So that's what's beautiful too. With little ones, it's just finding what are they really going to thrive with and have fun with, but also train their muscles and train their airway. And we have breathing games, and it is unbelievable. This 4-year-old I worked with, within, and everyone's results varies, of course, but within 3 months, she got 4 millimeters of palatal expansion.
Oh my gosh.
I had a palatal expander because I was so narrow when I was in middle school. Again, Maya wasn't around for me, but it is for this little one. And her mom and her dad worked so hard, and she got natural palatal expansion. That which means she made her airway bigger too. You
Amazing.
know, it's unreal. And so it is growing. I would project in about 10 years more and more Mayos will see 5 and under. The interest is becoming louder than the criticism.
Awesome.
And what these kids can do and what they know about their mouth is unbelievable. So I ask them all the hard questions, and they're so in tune. And it's just letting them have a voice also, and not just counting them out, because they know and they power through and stuff, but they know what their tongue does, what breathing feels like, and they can talk about it.
Amazing.
So I lean into that, and it's them changing their airway and body, which is amazing. They're doing it for themselves. So that'll always be my mission.
I mean, that is so phenomenal because, I mean, even just from a nervous system perspective, if you can get a little's nervous system calmed down because their airways like appropriate, then their whole life ahead of them. Oh my gosh, their whole life ahead of them is like their nervous system is more regulated, and
Yeah.
it's incredible. And also, man, it just fires me up that the party line is like, oh yeah, precognitive, you can't make any changes. And it's like you can play with a kid and have them do activities that move their body, move their face, move their tongue in unique ways or whatever. I'm sure you could speak much more eloquently to the actual intervention, but it makes total sense that you would do that. And
Yeah.
it's amazing to me too, just to name that you're like, well, I wasn't never probably trained in how to work with a 5 and under kid, but here's what I think would work. And then taking it forward, and then the proof is in the pudding when you get all these results. It's
Yeah.
so cool.
Thank you. Yeah, I've honed in. It's taken a while to really develop
Mhm.
that side with Myo principles, but approaching it to little ones. I mean, they still have a tongue, they still have an airway, they still have lips, like the muscles are there. And then, yeah, with the nervous system part, why not build the toolbox now versus the repair kit? Or, oh man, there's anxiety now. What do we do? How do I breathe? A lot of parents write me and they go, my kid had a meltdown and they told me I just need to sit and breathe for a moment. Like, and they're like 4. I'm like, what? And is just, yeah. So building the tools now, potentially preventing or empowering so much young instead of, like part of the funny story with me is when I was getting my master's, it's all about breathing and respiration and all that. I developed panic attacks because I analyzed my breath so much, too much, but then I didn't have tools. So it's like, even if you're studying or trying to do something great, if you're over, we can over, where am I going with any of this?
Over
Like I didn't have the
intellectualize.
tools then, like just breathe, or just relax and breathe. No, that did not work. But kids can have the same reaction to stressors and life and change, and they're going to school and making friends and met with so much, and they're learning so much that I would rather build a toolbox young, help families build their toolbox, even just the household nervous system toolbox. you know,
Mm.
that anyone and everyone could have versus, oh man, life hit me and I don't know what to do. And I don't know anything about my nervous system. I have no basis on any of it. So it's amazing. It's powerful.
I love this concept of a household nervous system toolbox. What? So
Yeah.
it sounds like you're also working with the parents and the siblings as much as the kiddos that you're working with,
Yeah.
which
I
makes sense.
see all families and it's lovely. And I cater to that. You know, we make family appointments. And then I try to make it not just like five individual plans, but like five specific plans. But how can we make it a family venture and family camaraderie? And it's neat when a parent says like, "Oh yeah, my child taught me how to do this exercise because I couldn't get it, and my kid taught me." And I'm like,
That's
"Man,
the coolest.
they're the best teachers," you know. And it just takes you just have to pause and listen, you know.
Oh, that's so delightful to hear. I love that so much. And I also want to just appreciate you saying that it's not like this is the Mayo protocol and this is step one and this is step two and we go through this protocol and if you don't fit into the box, I'm going to write you off. Like I
Yeah,
think so much of medicine is that way.
yeah,
So treating the individual and addressing the person in front of you, it's harder for you as a practitioner, right?
mm-hmm,
You're
mm-hmm,
working harder than you ever would delivering a protocol, but
mm-hmm,
your people are getting better and you're expanding the field to include this demographic of patients that were completely written off by the field. So I just want to like totally celebrate that approach because it is, I think, essential.
I agree. Thank you. But I agree too. That's where my personal story too. I was the outcast. I didn't fit the orthodontic mold and you know, you go home and have the meltdown at home because you don't fit in, you know, and it's like no one should ever feel that way. Everyone has a different story. And that's what's fun about every appointment, you know, that the exercises are fun, you know, we make silly faces and noises and be goofy, but just the connection of tell me about your experience. The highs, the lows, the yays, the bummers, the sensations, and that's part of the education too. Of like you, like a lot of people don't realize, oh, I get to tell my story, and it is my story, and it will stand. And a lot of people sadly come in, adults mainly, where, oh my gosh, I'm so sorry, I'm talking a lot. Oh my gosh, I'm so sorry, I'm over explaining. And I'm like, no, no, like that to me in the moment, I, it's an honor to hear their journey and what they're experiencing because that does help form the next plan, the next, set of exercises. But then it's their moment to be the captain of their journey. You know, I'm not the hero; they're the hero. But so that's been an interesting thing too with adults is just giving them that platform
Mm.
where they can talk and not have the pressure of, oh, did I answer right? Oh gosh, did I fit in? Did I blow it? Did I? No, there's nothing to blow. There's nothing to not answer correctly. So
Oh,
yeah,
that's so refreshing. Yeah, it's so refreshing. And you're basically like on a level unwinding people's medical trauma. Like,
mm,
because I think there is a lot of that in our current allopathic standard model. And I see people all the time who have been brushed off, written off, told it's in your head, go see a psychiatrist, blah, blah,
yes.
blah. And it's like, no, what actually happened was that practitioner had 15 minutes with you and didn't have enough time or capacity for connection, and the model they're operating under doesn't meet them where they're at. And it's so inspiring to see someone like you meeting people where they're at, seeing the whole family, incorporating all of that. It's this is how medicine should be, how interventions, therapeutic interventions should be, because these are human beings. They're not automatrons going through your protocol, right? It's like these are individuals. So,
Yes,
yeah,
I agree.
yeah. So it's really beautiful what you're doing, and I think that, well, I guess let's talk about your actual business. Like your business is called Joyful Breathing, which is so
Yes,
sweet. I actually want to show your website. Is that okay? Do you mind if
absolutely.
I share? I'm just going to share the screen, and if you want to, feel free to narrate as we go. But joyfulbreathingcolorado.com. I just love it. It's like so joyful. This is so sweet. And um, I just I think that it like your name encapsulates your approach, which I think is so important too. It's not like this serious, really challenging thing that you're doing. You're playing, you're exploring with kiddos, and I would imagine adults too. It's like a playful approach. So, um, if there's anything you want to share about, yeah, your actual structure and your business.
I think it is creating, my goal was creating a narrative that um, breathing can be joyful and exciting to learn about and explore, and yeah, just play, learn to play with the breath. And I think if you approach something from within reason, but an optimistic, positive approach, the brain and body will follow. And so, from my own storyline, I just kind of feel like my mission is to provide joy and hope. And myo isn't always the end all be all for people, but at the end of the day, if someone went away feeling seen and heard, and their storyline matters, and they matter, and their breathing matters, then that was a joyful day. And that, in my office, if a kid has a meltdown, I welcome it. It's definitely not, like you said, it's not robotic. And I think joy comes out of hard times also. Like joy isn't just, oh, my life's easy. Joy is like, wow, I made it through a really rough season, and now the sunshine looks different to me or something. Yeah, I don't know. But it's like you said, there's a lot of hurt and trauma and nerves that start in my office. So if we can just approach it from a joyful sense, then it really is empowering in what I see in families where they start to kind of question the status quo
Hmm.
and go, oh no, my breath can be joyful. It's not just bummer, as they once thought or was told
Yeah.
it was. So I like to have fun, and be silly and goofy. And the body is such a beautiful, powerful thing. It's not something to force and hate and be ashamed of, especially with the breath. The breath holds all emotions. So let's bring some hope and joy to it.
Amazing. That was lovely, Brittany. Thank you. Um, we'll wrap up soon, but I'm curious if there's anything that you want to share, if there's like one thing you could tell the world about Mayo, or any final thoughts before we close for today.
I think my of course, I believe in Mayo. I've seen lives be changed through it. I think what's beautiful about Mayo is it's not there is that like optimal age, but anyone can benefit from it. It is not oh man, I missed that window, bummer. There's always learning and growing to do within the oral and airway structures. So anyone and everyone can benefit. I work with 80-year-olds, all the way on up beyond 80, which is amazing and wonderful. And just really tune in and listen to what your little nuances are. And like, I think just take stock and evaluate your breathing, and that's powerful. Um, And then I think to the practitioners listening, my biggest thing that I stand by is if you do work with kids, I think talking to them and not just about them to the parents is groundbreaking and getting down on their level and asking them the questions that maybe someone may go, oh, they don't know. That's too hard of a question. I think really asking them the question and sitting in that silence if they're thinking about it. I found that in those moments where they're thinking through that question, it's the most powerful moment of my day because they're learning to think about themselves and advocate for themselves and give the answer and be respected for their answer. And that's, I think, going to teach them young versus a lot of us, we do have medical trauma where our story wasn't respected. So if we teach it young, your story is respected. I think that's going to change society.
Whoa.
Putting it boldly out there.
I love it. I love it so much because I totally resonate with that. And it's so, so wonderful that you're doing this. You're carving the way for this.
Thank
So
you.
thank you for doing what you do. Can
Thank
you
you.
just speak to how people can get a hold of you, get in touch with you if they're interested? Oh, also, my other question was, do you do this only in person? Is this doable online? How do people interact?
Yeah, so I do offer virtual, usually 5 and under, no. But sometimes we do a mixture if someone does come from a far place. But I have a lot of patients, adults, teenagers, kiddos that do all virtual because they're just based elsewhere. So very flexible, very, especially like with the winter months, I do a lot of virtual.
Or
No snowy drives. So very flexible and catered. And then I do have littles, like 4 or 5, that they can do virtual. So we do virtual. It does require a lot of creativity, but very doable. And as you mentioned, I am in North Glen. My website is joyfulbreathingcolorado.com. Through there's all my contact info. People can schedule a phone call with me to go over any questions they may have or email me. Um, yeah, if they have any questions, questions are the best. So don't shy away if you have any.
super. Well, thank you so much for being with me today
Oh,
and sharing and doing what you do, how you do it. It's really inspiring.
thank you.
We'll close for now. See you guys next time.